everyone. Welcome to Dialogues at FemTech 360. This brings you, in today's episode, everything that you needed to know about your pregnancy care. And Dr. Poorni Narayan, who is an associate consultant at the Divakar Specialty Hospital, will be interacting with you for this session. Where I would step in would be to bring home the insights into how technology has enabled us to make your pregnancy safer and offer you the better quality care. The very fact that we are able to talk to you on the platforms like these are technology enabled. So you'll hear more first from Poorni Narayan, and then sometime in between and repeatedly, I will be stepping in to let you know how we are using the FemTech
Can Divya stop the video play and can Dr. Poorni start, please?
At the outset, I would like to apologize for my bad throat and voice. Viruses decided to attack my throat at the most opportune of times. Please bear with this for the next hour or so. Jokes apart, a very, very warm welcome to all of you on this really good and hot afternoon for the first in the series of interactive webinars of the FemTech 360 series. Today, we hope to consult, collaborate with all of you, and clear a lot of myths and misconceptions, clear a lot of doubts, get them away from your heads, and allay your anxieties as far as pregnancy is concerned. Let us just have a brief look at what all we will be dealing with today. In the meanwhile, I would request all of you to keep your microphones on mute and also send in all your questions on the chat box, which we will be taking up simultaneously as we go along today. Can we have the first set of slides, please? So first of all, while pregnancy itself is a huge event in all your lives, once you get a pregnancy test positive, it is a lot of joy. At the same time, a lot of apprehensions do creep in. So to begin with, we do usually suggest that you all consult your obstetricians, consult us, even prior to pregnancy, so that you can begin right. You can start right, take care of the kind of nutrition that you need to have, the necessary prenatal vitamins, try and achieve the ideal weight prior to starting the pregnancy, exercise regularly, look at what you need to change as far as your sedentary lifestyle may be concerned. Next slide. Once you are actually pregnant, can we have the next slide, Divya? Once you are actually pregnant, we are there with you throughout the pregnancy to take care of all the fears that you may have, your regular checkups. Can we have the next slide? All the fears that you may have. But today, we will also be dealing with the exact nutrition during the pregnancy, the supplements that you may need to take, what is good, what is not good, what to avoid, how to change your diet so that you and your baby can thrive throughout the pregnancy. We will be dealing with next slide, certain complications which may be arising during the pregnancy, some common symptoms. So symptoms like heartburn and indigestion, we all know that in the first 3 months, it's difficult to deal with acidity, vomiting, nausea. So how to deal with all this? And also, especially towards the end of the pregnancy, next slide, please. Towards the end of the pregnancy, the swelling of the feet, this is one of the commonest problems that women ask us during their pregnancy, that my feet are swollen. So we will tell you why not to get worried about these problems which you may encounter. So these are all physiological. Physiological, what I mean by physiological is things that happen naturally during the pregnancy, which is not a problem, even though it may cause you some concern and discomfort. They're not problems. However, next slide, there are some issues which can create a problem during pregnancy. So these are some of the complications which, God forbid, we really don't want any of you to have these problems. But if they do creep up, for example, some of you may develop, especially in the last few weeks of pregnancy, high blood pressure, which we call in our parlance as preeclampsia. There may be gestational diabetes or sugar levels going up in your blood in pregnancy. And of course, during the delivery, we need to monitor the baby very closely, because certain times the baby may not be very comfortable inside, and some of you may land up with what we call as fetal distress. So keep your questions coming about all these topics so that I will try my best to solve all of them. Of course, I have Dr. Hema Divakar standing solidly behind me to take over in case my throat gives way or I'm not able to solve any of your questions. Some pregnancies, as I said, are high risk, and they do require a little more monitoring, more frequent checkups, more visits, and we do use the latest technologies. We have to make use of them so that you are comfortable sitting at home, monitoring your baby. At the same time, you are telling us, giving us a regular input as to how well your baby is. So we are also comfortable with how well your pregnancy is going along. And as I always tell our patients, the delivery is not the end point. It is the beginning of the entire journey. And once you have delivered, we need to keep in place what the postpartum care is all about. Recovery for you, recovery for your wound and for your activity, your diet, your breastfeeding support. Of course, you may be a first-time mother, you may be a second-time mother, but every baby has to be given its importance, and how you are going to deal with the breastfeeding, the changing of the diapers, the late nights, the burping and the spitting of the milk and all those things, not to increase your anxiety, but it is essential for you all to get prepared for these things from the beginning. So kindly establish a good support system so that you are not the only one, staying up at night, running around for everything, keeping track of things at home, maybe for your elder child, as well as for the newborn. So important is to give yourself enough time so that you enjoy this phase of pregnancy and postpartum. So we keep your questions coming so that we can deal with them as and when you put them up in the chat. So to begin with, like I said, you plan your pregnancy, you've been taking folic acid, you've probably gone to your obstetrician who has suggested a few blood tests, because we'd like to begin right. We'd like to have your things on par with anyone else, set the background right for a good pregnancy. So you're pregnant now, you get a pregnancy test positive, and you announce to your family. You may be a working woman, and you know that the next 9 months is going to be hectic time for you because you don't want to give up your job. You might have to travel to work, but at the same time, so many visits, so many interactions with your doctor. You will need some tests, some ultrasound. So your family and you will be wondering how you are going to manage to go through with so many checkups. Are they actually necessary? So let us listen to what Dr. Hema Divakar has to say about the frequency of visits, why, and do we actually need. As we're waiting for the video to play, I request you all to key in your questions. And whatever we are discussing in detail today, if you go into the FemTech 360, they've all been discussed in detail. So even after today's webinar, you can connect and look at things and continue to ask us questions even later on. We're always there to help you out. So we're waiting to listen to what Dr. Hema has to say about the frequency of visits and how we can help you cut down. Divya, can we have the video? Yeah.
Why a pregnancy needs so many visits, so many tests, so many interactions with the doctors.
We really need to see the patients so many times for the many things that the new era has brought with us, the problems and the solutions as well. Out of 10 times, maybe 4 times they will come into the hospital, physically connect and get some few tests done and get the consultation. But half the number of times we can still connect. And that's the whole purpose of this Connect and Consult program, which the Divakar Specialty Hospital has brought in, because this is the power of technology, the FemTech 360 as we call it. There are many times when they can just connect with us on the video call. They can get the whole lot of advice. Maybe it's a second opinion, maybe it's a report review, maybe it's just a consultation. I think everybody in this era is more blessed because they can beat the traffic, they can save their time and sometimes the money as well.
Thanks a lot, Dr. Hema, for giving us that insight as to how to cut down on the number of visits, how you all can connect with us virtually so that we can assure you about things which are going on in the pregnancy. I have a couple of questions here. Somebody wants to know that why so many ultrasounds in pregnancy, and are these ultrasounds safe? Are they safe? Isn't it radiation for the baby? So, to start with, ultrasound, as the name suggests, is not radiation. It is sound waves. It is a kind of sound waves. The frequency of the sound waves is ultra, it's much higher that we cannot hear with our ear. So it is not like an X-ray or an MRI. I agree with you that compared to maybe 30 years ago when we didn't have scans, when we didn't have ultrasounds, women used to probably come to us only around the 5th month when they used to start feeling the movements, and then they used to go in for delivery. But then with the advancement in technology, we want to make sure that things are fine for your pregnancy, for your baby. So we usually do a minimum of 3 ultrasounds in pregnancy, and these are just sound waves which are passing from the transducer through your abdomen into the baby and getting reflected back onto the screen. So it is as good as we communicating today. It is the sound waves when you're sitting in front of a television or when you're listening to the radio. It is the sound waves, so they don't harm your baby. So we do an initial 3rd month scan, which is the NT scan, where we want to rule out chromosomal problems for the baby. In the 5th month, we do what's called the anomaly scan, where we're looking to see as much as possible if all the organs of the baby are formed properly. And of course, the end-term scan, that is just before a month or so before your delivery, where we want to know the weight of the baby, the position, the water content, the blood flow of the baby, so that we can plan the time and mode of delivery. So, of course, 1 or 2 additional ultrasounds may be required. That, right in the beginning, we may want to see the heartbeat, make sure the growth is fine. And so don't get worried about the ultrasounds. They are not radiation and they don't cause harm to the baby. The second question that I have right now is to give insight on the exercise routine and any info which would help in a normal delivery. Dealing with the exercise part, the first 3 months sometimes is a little difficult to deal with because one is mentally and emotionally, you're just getting used to the fact that you're pregnant. Secondly, it may not be very easy for you to deal with all the symptoms. And symptoms are not necessarily, what's shown in movies. Everybody doesn't have only vomiting. It may be just exhaustion, feeling sleepy throughout the day, leg cramps, back pain, lower abdominal cramps, giddiness. All these things can contribute to a little, exhaustion. So what we usually suggest is don't try to do any activity first 3 months. Continue what you've been doing so far. Do not start anything new. And don't push yourself in the first 3 months. Listen to your body. What you are able to do, you do. What you are unable to do, just hold it off for the second trimester. Having said that, once you cross the first 3 or 4 months, the second trimester is actually the most comfortable of timings where actually you guys should plan your travel and all that, because once the baby comes into your hands, it's going to be difficult for you all to set off and move around. So the second trimester is more comfortable where you're able to eat better. But eat better does not mean that you eat anything and everything that comes into your hand, because this is the time when the complications that I was talking about, like diabetes and stuff, can come in. So be careful about what you eat, but at the same time, to keep your body healthy and fit, get into an exercise pattern of half an hour of walking per day at least. So if you all are able to manage half an hour at a time, well and good. If you're not able to, split it into 10 to 15 minutes, 3 or 2 times in a day, preferably after the meal, so that you know the carbs what you have eaten doesn't stick to you and you try and burn the calories that you have taken. Coming to what you can do to help in a normal delivery, I will deal with it closer to the end of the session when we're talking about the delivery part of it. Somebody else wants to know that in hot weather, when we need to drink more water, what are the recommended alternatives if you're experiencing nausea or vomiting, like barley water, sabza seeds, raw mung beans? Yeah, honestly, in this hot weather, especially, I mean, we've never seen Bangalore this hot. We used to pride ourselves on our weather, but yeah, nowadays we're sweating a lot. So yes, you guys have to keep yourself hydrated very well. So water, you can have lemon juice, you can have buttermilk, you can have any of the other things. Now I see barley water written. Barley water is good to keep yourself hydrated. But here I would like to bring in the myth that drinking barley water reduces the edema that collects, that is the swelling, the water retention in the body. It's a wrong myth. Barley water does not take away the swelling or the edema that develops, especially in third trimester. Barley water is good. You can hydrate yourself with that. So always you keep a bottle, a 1 liter bottle readily available for you. And in between, just keep sipping on it so that by the end of the day, you have had the necessary amount of fluids. Coconut water is good, but I always suggest that you have fruits with more water content in them, like watermelon, muskmelon, which will give you a lot of hydration, but do not take out the fiber and the nutrition from the fruit and make it into a juice and drink. That is not going to help you. That's just colored water. It doesn't really have that kind of nutrition. Any day, it is better to have fruits and fruits rather than fruit juices, because we also have a tendency to add sugar to the fruit juices, which is not at all good. Simple sugars, sugar in its plain form is better avoided. Right. I hope I have answered the questions so far. Moving on. Now, I've already had a few questions about diet. So to put it in a nutshell, if you want to have the ideal diet during pregnancy, I would just suggest do not change anything majorly. Don't try to, emulate or do something very different that someone else may be doing. Stick to what you have been having so far, but the tastes may differ. What you would like to have, what you may not like to have may be very different. So in the first 3 months of pregnancy, do not look at nutrition, whether your baby is getting proteins, whether, adequate nutrition for the baby. No, because in the first 3 months, the baby is like a parasite. It will take from you. So just make sure that you're having small and frequent meals. For some people, liquids may help. For some people, dry things like toasts and biscuits may help. For some people, just carrying to work a few small boxes of dry fruits or more nuts rather than dry fruits, like your almonds, your pista, just carry 3 or 4 boxes. Maybe one box can have dry fruits, one box can have salads, You can have a full glass of buttermilk, which will fill you up, which will hydrate you, but at the same time, it may not increase your calorie intake. Once we move into the second trimester, then your focus has to be more on the protein intake. So you all may know that in pregnancy, a woman requires 300 calories more as compared to when she's not pregnant. However, again, the misconception that eat for two. No, you cannot eat for two. It is not eating for yourself and the baby and people around you. Your family may keep telling you, eat, eat, eat. Then only the baby will grow. No, you may end up putting on 20 to 25 kilos if you keep following that dictum. But remember, the baby is not going to walk out as a 10-kilo baby. Even if you put on 20 to 25 kilos, the baby is going to be 2.5, 3.5 maximum. So your eating and weight gain is not directly related to the baby's weight. Yes, for the baby to be healthy, that 300 calories increase in the weight, split it into maybe 50% of carbs, but that also keep the simple sugars away. Like I already mentioned, the sweets, the chocolates, the ice creams, the cakes, they may sound very tasty, but they are not healthy for your baby. Increase your protein intake. Milk and milk products, your paneer, your soya, your grains, your pulses, egg, the white of the egg, and the non-veg food, as long as it's not prepared in too much of oil or fat. And of course, increase your fat content to a small degree, because that little bit of fat is required for the proper brain development of the baby. Yes, I have put it into a nutshell, but it can be very confusing. Really is confusing. So let's listen to Dr. Hema and find out how FemTech is going to help us deal with these dietary concerns. Keep your questions coming in the meanwhile. Divya, can we have the video, please?
The diet in pregnancy becomes so difficult. How do we help our patients?
Think nutrition first, because that is the most important aspect of the care in the pregnancy that we ought to give. I think that again the Femtech has come to the rescue, because many who are viewing this program may already be getting on to some apps and some recipes and gather for themselves how much proteins, how much fat, how much carbohydrates, what's in it for them. But specifically, there's a nutrition checklist that we offer the patients both on the digital platform as well as in their in-person visits, where what is the kind of food groups that they will take, what proportion, how many times in a week they will take that. If they record that, okay, like a journal keeping, then it brings home the point where the gaps are and what they must be focusing on.
Right. So while we are on the diet, I would like to take away one more myth that a lot of you may have. We have a lot of women asking us, at what stage in pregnancy should we start saffron? So saffron is supposed to be good for improving the blood circulation. So there's no harm. If people at home are asking you to take saffron, no harm at all. But if they are asking you to take it to improve the complexion of the baby, please do not think that your baby is going to be fair because of taking saffron. The complexion of your baby is decided the day you conceive, and neither taking saffron nor doing anything else is really going to improve it. If it does, you and I can take a lot of saffron to Africa and we can make a roaring business out of it. So yes, saffron helps in improving the blood circulation, but not necessarily, not at all actually, in improving the complexion of the baby. Okay, moving on. Now we have kind of, moving along. Second trimester, like I said, is the most comfortable, and you begin to feel the movements 5th to 6th month onwards. So you're a little more comfortable because you know that the baby is moving, baby is well. But once slowly you start entering into the third trimester, you as well as we start wanting to monitor our baby a little more closely. We want to make sure that the baby is growing well, and at the same time, We want to reduce the number of visits that you may need to have in the third trimester. But how to make sure that you, as well as we, know that the baby is fine? Now, coming to the monitoring of the baby, how many of you have heard of the latest technology, a device called Baby Beats? Can I request the audience to give a thumbs up in case any of you have heard of this? Baby Beats. Baby Beats, yeah. So if any of you have heard of it, well and good. Otherwise, we will elaborate. Of course, as some of you may know, around 35 to 36 weeks of your pregnancy, we do a heartbeat recording, which is like an ECG performed for the adults. This is a tracing of the baby's heartbeat, where we do it in the hospital usually to tell us about the well-being of the baby, where we put a probe of the probe on the mother's abdomen, and the heartbeat comes out as a trace. I see that Minu has given a thumbs up because she's aware of this Baby Beats. So this Baby Beats, what is it? How does it allay our anxiety? What does it do to make us sure that the baby is fine and you are also comfortable? So let us look at what this Baby Beats is.
The diet in pregnancy becomes.
So let me tell you what we do with the baby beat at our hospital. Suppose you come to us, you have had a pregnancy with IVF maybe, or you are one of those highly strung, anxious person. Every other day you think, oh, my baby is not moving, let me rush to the doctor and then have it. Or unfortunately, you've got your sugars very high or BP very high, which is not an uncommon thing in today's era. Then all that I've got to tell you is, I need to see your baby's heartbeat trace at least twice a week, especially in the last about 6 weeks of your pregnancy.
And that's the clinical guideline, right?
Yes. But I don't want you to travel miles together to come here. Take this home, easy to use. Download the app, place it on your abdomen,
Yes.
click the on button, do it every alternate day. Send me the report by Bluetooth. I'll give you a thumbs up if all okay. Otherwise, I'll call you back because I need to see you again. Is it as simple as that?
Absolutely.
They made it appear so simple. Honestly, is it that simple? Because nowadays technology has really advanced. The device seems really small, but is it that simple to use? Can you really take it home and record your baby's heartbeat? Can we monitor it so easily? You heard what Dr. Hema has to say about the baby beats. Now let us listen to one of our dear patients who had the necessity to use the baby beats, and let us see what her experience was with this. Divya, the next video, please.
This is Dr. Poorni Narayanan. Every pregnancy is precious. However, there are some pregnancies more than precious, they are high risk. If there is something for the mother or for the baby which is worrying us, especially towards the end of the pregnancy, we warn the mother that she may need to come for more frequent checkups, or if she feels that the movements are less, we call her for regular checkups. However, in the recent past, we have this instrument, the FetoSense, which monitors the heartbeat of the baby, which we do regularly in the hospital as an NST. We can give this to the mother and ask her to monitor the heartbeat on a regular basis at home. The advantage is that she herself can see it and she can send it to us, by means of which we can monitor the well-being of the baby. Let me introduce Bhavani to you all. She is one of our very dear patients who unfortunately had some complications even before this pregnancy. And in the present pregnancy, towards the end, there were blood flow issues, there were Doppler issues, the AC of the baby was falling. So we felt the necessity to monitor this baby on a more regular basis. So we asked her to take this instrument home with her. We taught her how to use it. We'd like to listen to her feedback on how she felt using this monitor and how comfortable she was using it. Bhavani, over to you.
Hello everyone, I'm Bhavani. As doctor said, due to some complications in my pregnancy, I was under constant care and treatment from the very beginning. During my 35th week, I was given the NST device to monitor the heart rate of the baby. This device was very friendly and can be easily operated as well. This helped me from providing assurance and monitoring the baby's heart rate, and it avoided me from unnecessary visits to the hospital. I would like to thank doctors at Divakas who were constantly monitoring the reports on a daily basis through WhatsApp itself. So, and I would like to, I would encourage all the high risk patients to utilize this device so that they need not worry and they will be free from anxiety about the baby's movements on a daily basis. Thank you, everyone.
Thanks a lot, Bhavani. Just a few words on how easy it was for you to use. Was it very complicated to download the app and then to, put on the monitor on your abdomen, send it to us? Was it very complicated? Did you have to take anybody's help, or
No, it was self-friendly, as I mentioned. It was just like an other app. We can just download it on on our regular Android phones, and the device is also self-reliant. We need not approach somebody to help us on monitoring or to tie up on our abdomen or something like that. It's as I mentioned, we can keep it on our abdomen and tie it up, and we can work as well as we can monitor the heart rates and heartbeats, movements, everything regularly. So it was very friendly as well.
Excellent. Thank you so much. And we're all so glad that your pregnancy went very well. Hearty congratulations on the birth of your son. And we hope more of our patients will make use of this device, because as you all have heard, it is so user friendly and it is very easy to use. And more than anything, it allays all our anxieties, the obstetrician, the mother, the father, as well as the baby. So good luck to you and thanks for joining us.
Thank you. Bye.
So not only we, but Bhavani also felt that the baby beats apparatus is very useful, not only for monitoring the baby, but also for decreasing our anxiety levels. You might have noticed that, Bhavani kept talking about some complications that had cropped up during her pregnancy. And even before that, I did mention a couple of things that may come in towards the end of your pregnancy. Yes, we all want you all to be complication free, but then there are certain conditions which kind of are a little unavoidable. So what are these problems that we can expect? The commonest, especially in India, that we are seeing definitely on the rise nowadays is gestational diabetes, that is diabetes in pregnancy. So India is becoming the diabetic capital of the world, and we are doing tests for all women during the pregnancy, which is called a glucose challenge test, where we give you glucose to see how your body is able to handle the excess carbohydrate during your pregnancy. Unfortunately, some of you do develop this GDM or gestational diabetes, but please be reassured that diagnosis is important, but having diagnosed, most women who have been diagnosed with gestational diabetes can be handled with diet and exercise alone. There is a very, very small percentage of diabetic women who end up needing medication or insulin, that kind of therapy. I see a question on the chat box, if yoga can help in normal delivery. So again, I will deal with this when we really come across the delivery part of it. Moving on with gestational diabetes, I said we can deal with the gestational diabetes with diet and exercise most of the time. So how much do you have to change in the diet that I've already mentioned? If you are diagnosed as a diabetic in pregnancy, all you have to do is cut down a little more on the carbs that you are eating. Do not change anything too much. Continue with your small and frequent diets so that there is no load of carbohydrate to your body. Your pancreas, which is secreting the insulin, is not loaded to produce too much insulin at a time. So we usually tell our patients to take a plate divided into four and make sure that the carbs, that is the rice, the rotis, the ragi, whatever you're having in form of the carbs, occupies only 1/4 of the plate. The remaining three portions should be with your protein, which is your pulses, your non-veg food, your eggs, and the two portions have to be full of vegetables. No need to cut down completely on the fruits, but we usually say the sugary items, the sugary fruits like banana or chiku, for example, have to be avoided. Grapes, they are the sweeter fruits, whereas you can have apple. If you're having mango, it has to be a very small amount because that's one of the sweeter fruits. So that is the way to alter the diet. The diet has to be altered, and exercise in GDM, that is gestational diabetes, no need to alter it. If you're going for half an hour walks, split it like I said before, 10 to 15 minutes after each meal so that the calories do not get absorbed. But yes, once you are diagnosed as a diabetic in pregnancy, regular monitoring of your sugars will be required, which we will take you through. And diabetes is not like an unmanageable condition. It's easily managed. Someone else is asking me that if there is diabetes in pregnancy, will my baby also develop diabetes? No, not if your sugars are well under control. This is not a transmitted disease. That is, you do not pass it on to your baby. If your sugars are not well controlled, then the baby receives blood with very high blood sugar levels. The baby ends up being much bigger. Bigger doesn't mean healthy, because your body is programmed to supply nutrition only to a certain size of baby. But this baby is grown too large, and your body is unable to supply the nutrition required for this baby. That is the reason we need to control the sugars. The baby is not born with diabetes. It does not develop diabetes because you had diabetes. But again, I would like to insist at this point that a healthy diet and exercise routine has to be brought into the system for all children and adolescents. Do not think that your diabetes is over once you deliver. If you want your child to be healthy as an adolescent and as an adult, put them into a regular exercise and diet routine so that they do not develop diabetes as they age. So that is about the diabetes. The other complications which can develop is high blood pressure. Again, high blood pressure is something that we see towards the end of pregnancy most commonly. It only means that your heart is requiring to pump blood with more pressure to be able to reach the baby. So, high blood pressure in pregnancy is a condition which needs to be kept under control. This usually comes in again like the diabetes because of the pregnancy hormones. It is not like the blood pressure that elderly people develop. So, another common misconception here is to reduce your salt intake. People, your family members may say that cut down on the amount of salt that you're taking because that is leading to an increase in the blood pressure. That again is wrong. That is the blood pressure that elderly people develop. That is the blood pressure because salt is hygroscopic. It tends to absorb a lot of water. The blood volume increases and the heart is able to unable to handle that load. Whereas in pregnancy, salt reduction does not help in bringing down the blood pressure. There are other things that we do. There's a certain medication which have to be given to keep the blood pressure under control, monitor the baby very frequently, and then take you to the finish point so that you have a healthy baby. So somebody is asking me, what are the reasons for the bigger baby, higher baby weight? The most common reason is genetics. If your husband is 6 feet 2 inches tall, you are 5'7", both of you are big built, your baby ends up being slightly on the larger side. So now we are slowly, with Priyanka's question, we are slowly coming to the delivery part that most of you have been asking from the beginning. Okay, so the baby can be larger in size if you and your husband are well built. That is the commonest cause. The second, like I said, second common cause would be gestational diabetes if not well controlled. If the diabetes in pregnancy is not well controlled, the baby tends to put on a little more weight than usual, but that is not very healthy. That is not very healthy. So someone else has asked me, can yoga help in normal delivery? Okay, now delivery process. We have women asking us right from their first visit, will I have a normal delivery, doctor? My usual answer to them is, you have as much a chance like anybody else of having a normal delivery. That is nature's way that all pregnant women should have a normal delivery. But in this day and age, there are certain problems, there are certain complications, there are certain situations which make us decide the other way. So the first visit of pregnancy is not the right time for us to assure you that you will have or won't have a normal delivery. Honestly speaking, neither you nor we have a complete control on whether you will end up having a normal delivery or end up with an operative delivery. If there are no problems or complications, some of which I have dealt with already, diabetes, high blood pressure, baby's heartbeat dropping, water around the baby coming down, if there are no problems, we usually wait up to the due date for you to go into spontaneous labor. That is, labor pains begin on their own, because that is the best form of labor. Your body decides that it is time for the baby to come out. The contractions begin. The uterus tries to push the baby into the birth passage. The uterus can only do so much. Ultimately, it is the proper fitting of your bony pelvis, the bony structure which is there inside which the uterus, the non-pregnant uterus was there, and it has grown now to such a large size, that and the fit of the baby's head moving into the pelvis. I usually give an example of you trying to put a coconut into a large vessel rather than a small glass. How much ever you try, you may not be able to insert the coconut into a small glass. However, if the vessel is large, the coconut moves in very easily. So it's basically what we call as a cephalopelvic proportion. That is the proportion between the head size and the pelvis. Remember, both these are bony. They cannot be compressed like our muscles and tissue. So here we come to the point of yoga. Doing yoga will make you more flexible, will make your muscles give way easily to the soft tissue in the birth passage. It will make you more flexible. It will make you feel more healthy. It may not help you in controlling your weight. At the same time, it may not ensure a normal delivery. You might be doing yoga throughout pregnancy, which is very good. I'm not saying don't do it. That's very good. But if your baby is sitting in a breech position, that is with the head on top and the bottom below, it is not possible for you to have a normal delivery, because the mouth of the uterus will start opening. The head of the baby is the largest portion. That needs to come out first. For that to happen, the mouth of the uterus has to open 10 centimeters. If it is a breech, the mouth of the uterus will open only partially, maybe 6 or 7 centimeters. The entire body of the baby slips out, and we do not want the head to get stuck. So yoga will help in flexibility, in keeping you healthy, no doubt about that. It does not ensure a normal delivery. The second thing about the fit that I was talking about is also the position of baby's head. The head may be facing the birth passage, but it needs to bend completely. Only then, that we call it a flexed position, only then will the head of the baby enter into the bony pelvis. The same example of the coconut and the vessel. The vessel may be this big. If we keep the coconut sideways, it will not enter. But if we change the position of the coconut and keep it like this, it will easily enter. So these are things which can be decided only in last 2 to 3 weeks. We assess the water level around the baby because it forms a very good cushioning for the baby to go through with the labor pains. Remember, when the uterus is contracting over the baby during your labor, it is compressing the baby. It is compressing the umbilical cord, which is responsible for the blood supply for the baby. So if the water level around your baby is good, it is going to cushion your baby very well. Your baby will be able to take the compressions well and things progress well towards a normal delivery. However, unfortunately, if the water level starts coming down towards the end of the pregnancy, then we may have to think about the mode of the delivery. Yes, I have been talking about delivery, and other very, a lot of anxiety in your minds about the pain that you'll have to undergo during labor. Okay, my sincere suggestion would be to be prepared, but not get overly anxious about the labor pains. All of you will be able to go through with the pains. We will be helping you by teaching you the breathing exercises. So regular breathing during the contractions helps to wash out the carbon dioxide from the body, which actually brings down the pain. It takes up your pain threshold so that you're able to tolerate the pains much better. So what I always tell women is, do not waste your energy in screaming and shouting, because you will need that energy to push the baby out towards the end when the head has to come out. Yes, there are other things that we can do to bring down your pain. That is, painkiller injections can be given. And of course, you all must have heard of the epidural analgesia, which is a form of pain relief where we need to call the anesthetist and they give a very simple and small drug which is given in the space outside your spinal cord. Okay, so this will numb your pain sensation. It blocks only the pain nerve fibers from waist below so that you will not feel pain. However, towards the end of labor, when you need to push the baby out, you will feel the pressure sensation. You will be able to push the baby out very well. Same goes for in case we need to take you up for some reason for a cesarean section. Cesarean sections are usually done under spinal anesthesia, which is partially similar to epidural analgesia, what I just spoke about. So a very common myth, that most of you harbor is that after spinal anesthesia, my friend has a lot of back pain. This is totally wrong. It's a real misconception. Please don't go into a cesarean having this mindset that I am going to have back pain. The back pain that follows a delivery, whether it is normal or a cesarean, is for two reasons. One is your posture during the pregnancy, because we think that the uterus is only growing in front. No, it is also growing behind, because of which the backbone curvature is changing to accommodate the growing uterus. So once you deliver, the backbone curvature is going to come back to normal. So your posture during the pregnancy is very important. Try to sit straight. If you are working in front of a computer or for a very long time, yours is a sedentary kind of a job, we suggest that you put a bolster or a small cushion at the small of your back so that every time, you slouch, the bolster reminds you that you're supposed to sit up straight. The second thing that you must do is don't sit at a time for prolonged hours. After every hour or so, get up, move around for a little while, come back and sit down. The other reason for the backache is the breastfeeding posture. Once you deliver, the breastfeeding is what we ask you to focus on mostly. So remember, you're not going to feed the baby maybe 10, 12, 14 times in a day. Each feed is going to be anywhere between 40 to 50 minutes, 15 to 20 minutes on each side. So the normal tendency for women will be to slouch and feed the baby. So that is a wrong technique to do. We usually have lactation consultants coming in after you deliver to teach you the right technique, how to hold the baby in the crook of the arm and rest the bottom in the palm and keep one or two pillows on your lap and keep your back straight. Your position is very important so that the baby will be able to suck well rather than keeping the baby flat on your forearm, in which case you need to bend. So if you ask women who have had a normal delivery, they will also complain of backache. But women who have had a C-section, if they have a preconceived notion in their mind that it's because of the spinal anesthesia, then their backache will not go. So posture is very important. God has made us as human beings. We should have our back straight. We are not animals where we have our backbone parallel to the ground. So that is about the anesthesia and breastfeeding. Now I spoke so much about the complications. I would like you all to listen to one of our patients who did have a complication. We gave her the baby beads and let's see how happy she is after using the baby beads and how her pregnancy was monitored and the outcome was as expected, very good. Divya, can we have the last video, please?
Hello everyone, this is Sumaya Taranum here. So during my last stages of pregnancy, that's the 36th week, I had to undergo severe hypertension, that's high blood pressure. So doctor had advised me to monitor my BP and the fetal heartbeat at home. This NSD device has helped me a lot to monitor the baby's heartbeat on a regular basis at home, and it was very convenient and easy to use.
It is indeed so heartening for us to receive these feedbacks from our patients. Any of you have any more questions, please key in so that we can, get back to you and solve your questions. And I would also request all of you to visit the Health for Her app. And there are a lot of videos put up there and connect with us for the video consultations. We have put up the numbers of the contact details. Divya and Harshita, you can contact them and you can video consult with us so that you don't need to run every time you find that there is an issue or you're anxious about something. Do feel free to connect with us. We are always available to you. And if there are no more questions, I'm just seeing if there are any questions. If there are no more questions, of course, we're always there to help you. Team Divakars is walking along with all of you every step of the way. And we hope that we can deliver all your healthy babies and your journey of motherhood starts on a very, very positive note. We do have a few minutes to take up any questions if anybody wants. So the take-home message here would be enjoy your pregnancies. Do not get anxious because pregnancy, after all, we must realize is a physiological condition. It is not a disease. It is not a pathology. It is not a problem that you have to deal with. It is a time in life where you have to enjoy the pregnancy. Somebody is asking me, they're already ready after listening to our webinar for the next pregnancy. How soon can they get pregnant again? How soon can they get pregnant is usually more a social decision rather than a medical one. But we would definitely suggest a minimum of a couple of years, maybe, gap between the two. Because, yes, the body does come back to, we say almost the normal within 6 weeks of delivery, whether it is a normal delivery or a cesarean. But like I said, motherhood is something which is an ongoing journey. And parenthood, I must say, because I'm sure all your husbands are holding your hands, to take you through this journey. So give it that much time in between. But how can you avoid that time gap? I mean, how can you avoid a pregnancy during the time gap? So we do discuss contraception with all of you. Towards the end of the pregnancy, we do offer to you what are the choices available so that you can make a calculated decision as to when you want the next pregnancy and decide accordingly, because you don't want an unwanted pregnancy thrust into your hands. Because we do see a lot of women coming in and saying, no, we're not planning so soon, but it has happened. So what do we do? So we want you to have your next baby when you want it and not by chance. So please plan your pregnancy, whether it's the first one, starting with the first pregnancy, pre-pregnancy care, throughout the pregnancy, and next pregnancy. So with that, we come to a close for this webinar. I would like to request everybody to please make use of all the latest technologies that we have talked about today. Connect with us. You can consult, and we are always there to guide you and help you. And thank you very much to everyone involved from Team Divakars. Thanks a lot. We hope to meet you again personally and virtually throughout your pregnancy. All the very best.